स्ट्रक्चर क्या रहता है ना, एग्जाम का जो एग्जाम का जो स्ट्रक्चर रहता है उसमें ये होता है कि बेसिकली ये हर मॉड्यूल से एक क्वेश्चंस करते हैं और उसके फिर फॉलो अप क्वेश्चन रहते हैं। क्वेश्चन जो है वो बड़ा थोड़ा लेंथी होता है और उसको आपको याद रखना होता है उसमें क्या क्या उन्होंने पूछा है और उसका फिर आंसर करना होता है। कोई चीज़ आपने भूलनी नहीं होती। तो उसका बेस्ट तरीका ये होता है कि जब आप इंटरव्यू में बैठे हुए हैं तो आप वो क्वेश्चन को कोशिश करें कि राइट कर लें, उसमें जो की पॉइंट्स है ना उसके क्या क्या आंसर करने हैं। अगर आपको लगे कि आप मिस कर गए हैं कुछ तो आप उनको आस्क कर सकते हैं दोबारा से कि भाई प्लीज कैन यू रिपीट द क्वेश्चन, कि भाई मैंने आई कुड अंडरस्टैंड, कैन यू प्लीज रिपीट द क्वेश्चन। तो वो फिर रिपीट करेंगे आपको तो उस पर आएगा क्वेश्चन, तो उसमें हेजिटेट नहीं करना। आप जो है ना उसको दोबारा से पूछने में कोई हर्ज नहीं है, ठीक है। अगर कुछ क्वेश्चन तो बड़ी
ठीक है
स्ट्रेट
सर।
फॉरवर्ड होंगे उसमें पूछने की जरूरत नहीं है। अगर कुछ क्वेश्चन इसमें आपको लगे कि यार हाँ इसको पूछना जरूरी है तो उसमें आप पूछ सकते हैं। एक चीज तो ये हुई है। दूसरी चीज ये है कि इंटरव्यू के दौरान जो है ना आपने एक कुछ एडमिनिस्ट्रेटिव पार्ट रहता है क्वेश्चन का और कुछ जो होता है टेक्निकल पार्ट रहता है और कुछ जो होता है वो फिर एडमिनिस्ट्रेटिव पार्ट आ जाता है बाद में एंड। तो एडमिनिस्ट्रेटिव, टेक्निकल एंड देन एडमिनिस्ट्रेटिव। जैसे मैं एग्जांपल देता हूँ कि कोई क्वेश्चन अगर वो पूछते हैं रिलेटेड टू कि भाई एक्सीडेंट हुआ, रेडिएशन एक्सीडेंट हो गया, आप कैसे उसको मैनेज करेंगे और कैसे आप उसकी जो ना वो करेंगे, इन्वेस्टिगेशन करेंगे कि ये हुआ क्यों, हमारे कहाँ पे फ्लॉज था, ठीक है। वो फ्लॉज फाइंड करेंगे, फिर उसके बाद आप दूसरों का इंटरव्यू करेंगे और फिर वो डाटा कलेक्ट करेंगे, फिर उसके बाद आप उसकी टेक्निकल पॉइंट की आप उसको देखेंगे एक्सीडेंट में कितनी डोज मिली, क्या हुआ, ये सारा टेक्निकल आ गया उसमें। फिर उसको कैसे मेजर करेंगे, उसमें क्या क्या स्टेप्स आएंगे, ये टेक्निकल पार्ट है। फिर लास्ट में प्रिवेंटिव मेंटेनेंस आ जाएगी कि आप उसको कैसे प्रिवेंट कर सकते हैं कि बार बार दोबारा नहीं हो ना ये सेम सेम प्रॉब्लम। तो ये बेसिकली क्या हुआ, दो टेक्निकल दो एडमिनिस्ट्रेटिव पॉइंट्स के दरमियान में एक टेक्निकल पार्ट बीच में वो ऐड कर दिया
ठीक है।
हमने। तीसरी चीज जो है वो ये रहती है कि आपने जब भी क्वेश्चन को आंसर करना है ना तो उसमें आपने 4 से 5 चीजें हैं जो अपने अपने की रखनी है। सबसे पहला एडमिनिस्ट्रेटिव पार्ट है, मसलन रिलेटेड टू कमीशनिंग है, उसमें भी एडमिनिस्ट्रेटिव कोई भी मतलब फर्ज करो कि चैम्बर कमीशनिंग। तो चैम्बर कमीशनिंग में क्या होता है कि जब आपका चैम्बर आपने ऑर्डर करते हैं तो आप कंपेयर करते हैं आपके ऑर्डर नंबर से कि आपने जो मंगवाया था वही आया कि नहीं। फिर उसके अंदर उसके डॉक्यूमेंट्स पूरे आए हैं, उसका मैनुअल आया है, उसका कैलिब्रेशन सर्टिफिकेट आया है, ये सब चीज़ें जो है ना। और उसके अंदर जो कनेक्टर अगर आपने मंगवाए पड़ते हैं, आपके कनेक्टर डिफरेंट थे तो आप कनेक्टर्स को चेक कर सकते हैं। फिर उसके अलावा ये चीज़ खत्म हो गई, ये टेक्निकल। फिर उसमें एक चीज़ आती है सेफ्टी। सेफ्टी के अंदर 3 चीज़ें आती हैं। एक होती है इलेक्ट्रोमैकेनिकल सेफ्टी, ठीक है। एक होता है रेडिएशन सेफ्टी और एक सॉरी एक होता है जनरल सेफ्टी, इलेक्ट्रोमैकेनिकल सेफ्टी और रेडिएशन सेफ्टी। तो ये 3 चीजें आती हैं सेफ्टी के अंदर। फिर चौथी चीज जो आती है वो आपका टेक्निकल पार्ट आया जिसमें आपकी डोजीमेट्री है, ठीक है। डोजीमेट्री तो पहला पार्ट एडमिनिस्ट्रेटिव, दूसरा एक मिनट होल्ड करें, faculty speaking for medical physics. Where you calling from? Oh yeah. That's not a problem. But I'm actually in the meeting. I already replied. I already replied it. Now what are the, you asked me the tracking number and the address, and I already did give it to you. It is in my complaint where I put it in the complaint. Yeah, I did not. It's not happened 4 times. This is the 4th time. 76 Old Street, QDL 6105. Can we start now?
Yes, we can start.
Okay. तो उसमें मैंने बताया था कि कहाँ थे हाँ टेक्निकल उसमें फिर डोजीमेट्री आ जाती है। डोजीमेट्री के अंदर फिर आपके बहुत सारे स्मॉल स्टेप्स हैं जो भी आप करेंगे उसमें। फिर उसके बाद क्या होता है कि जब आप वो खत्म हो जाता है डोजीमेट्री के स्टेप्स खत्म होंगे तो फिर उसमें आप टेक्निकल आपके एडमिनिस्ट्रेटिव पार्ट शुरू हो जाता है जिसमें आप रिपोर्ट राइटिंग कम्युनिकेट टू द टीम उसमें और उस पर अपनी जो आपकी वर्कशीट्स हैं उसमें उसकी एंट्री और इसके अलावा उसके क्या कहते हैं उसके अगर कोई ऐसा इक्विपमेंट है जिसकी ट्रेनिंग रिक्वायर्ड है तो फिर वो ट्रेनिंग भी पार्ट आ जाती है। मतलब फर्स्ट करें SGRT आपने कमीशन किया, SGRT के अंदर आप दूसरों को ट्रेनिंग देंगे। फिर उसके अलावा आपका क्लिनिकल रिलीज नोट्स हैं तो ये सब चीज़ें छोटी छोटी आ जाएंगी इसमें। ये फिर एडमिनिस्ट्रेटिव एट द एंड आ जाएगा। तो बेसिकली इस तरह से आपने क्वेश्चन को एड्रेस करना है। तो मैं कोशिश करता हूँ क्वेश्चन शुरू करते हैं। क्या कहते हैं रहीम? कहाँ गए?
Yes, sir.
असद?
Yes, sir. We can start.
ओके। सो ये प्री पास क्वेश्चन है। ये बेसिकली यहाँ पर इसी के SEM के अंदर उन्होंने फाइनल एग्जाम्स के अंदर पूछे थे। तो उसका पहला पार्ट है तो मैं उसको पढ़ता हूँ और फिर आप में से कोई एक आप जो भी आंसर करना चाहे उसको आंसर कर सकता है। अच्छा, योर डिपार्टमेंट has a linear accelerator which need to be replace the electron gun last week. Profile, absorb dose, calibration were checked and all within tolerance. After a week, today RT has reported a jump in output of 1% and symmetry by 2% for 6 MeV and 12 MeV beam. Your chief asked you to investigate the problem and describe what step you will take to address to investigate this situation. I can put myself on hold. आप में से कोई भी क्वेश्चन का आंसर दे सकता है। आप आपस में किसी को सेलेक्ट कर लें जिस कोई भी अगर आंसर करना चाहता है फिर हम इसको
Okay. Can you repeat the last part of their question?
very good. This is what I want because you have to be understand this situation. The reason is very good. You ask the question because if you don't have the question very well understood, it's very difficult to answer it. And sometimes it leads you to something else which you don't want to answer. They didn't ask you basically. So now we can go back to the last part is today the artist after a week, the artist has reported a jump in output of 1% and symmetry by 2% for 6 MeV and 12 MeV electrons. The chief has asked you to investigate and describe what step you will follow to investigate this situation.
So it says 1% and 2% simultaneously for 6 MeV and 12 MeV. That's right?
No. 6% in output and
The 6%.
symmetry by 2%.
Okay. 6% in output. Okay. So first we can check the equipment which is used for this verification, like a daily QA equipment, whether it is placed properly and the connections are okay. First we verified ourselves. Then if the problem persists and we will get the same answer, then of course we will go with the um, dosimetry equipment like pharma chamber and solid water or water, whatever the department have. and verify the output first and then the profile, or is that right? Or we have to elaborate more?
Any answer? The answer looks all right, but I think so. This there are a few issues with that actually. Always when you actually have this answer, you can come across during your training, during your job about this kind of situation. So what if it has happened in your department? Just try to tell them that in my department we have this issue in the past, for example, and then we were normally using, daily QA 3, which can provide you the output as well as is give you the symmetry and flatness. So daily QA 3 is a pretty robust system, but still because it's a very limited system. So then my recommendation is I would first of all discuss with the artist and ask him how the trend of the system is behaving, how this trend of the system. Because from the last week, you go and have a look at the trend first. What has happened in the last 7 days or 6 days for last week? Because it's last week, they said. You have to find out the actually what happened in the last 6 7 days, how the trend behaving. Secondly, you have to see your equipment which you are using it, how old the calibration is. Because sometimes what happened, you have done your um, uh, uh, um, replacement of the gun, but what happened actually at that time you adjust everything, but you forget to do the daily QA 3 calibration. Am I right?
Yes.
So then after that, you can follow up the answer. You understand where I'm coming from?
Yes.
Okay, good. So third thing, actually, the first most important thing, the symmetry. You have to see the symmetry is only for two energies they're talking about. Maybe you have a more, if the system is not behaving well, it means something wrong. It's in terms of the particular energy, or maybe the other energy is also having some drift in it. Just have a look the other energies as well. So after that, when you quantify that these are the only two energies, go for um, setup, repeat the measurements again with your own settings, with the morning QA1. And if you find the same problem again, try the another device. If you have the another device in the other, because sometimes have the multiple devices, because if you have a more than 2 3 Linux, so you have not have a one single device for all the Linux. You normally use each individual Linux had its own device. Normally that's what we normally in, I don't know how in Pakistan should have like this, because it's not very expensive. So you can repeat the measurement with the other device and see you are getting the similar issues, because most of the machine are demeshed, so it should be behaving similarly. But if it is still the problem persists, you have to go and see the logs of the machine. Is anyone has done any work on the machine in the past 7 days after the electron gun has been replaced? Talk to engineers, discuss with them. Maybe they have done something on it. Maybe sometimes they tuned it because they have a different dosimetric fault or error coming up during the treatment. So they normally do what they tune it and they don't tell you. The second thing is actually um, the sequence of what what you have said is actually the sequence is very important. What do you mean? That you do the output first or you do the symmetry first in the independent system?
Okay.
So it's very important in the independent system. You should be doing the symmetry first. The reason is because if your symmetry adjusts, it may affect your output as well. So first of all, you should be checking your symmetry. Hold second, can you hold the recording so I can just have a call again? Hi, Talat speaking for medical physics. Can you start now? Okay. So it's better to do the symmetry first, make sure that the symmetry is correct, and then you do the output. So this is the one of the other thing. The third thing actually you didn't discuss about any. Whenever I told you there's a problem, incident and accident, just investigate why it's happened, how it's happened, and what are the precautions you have to be do it. This is part of the dosimetry which we done it. Now the last is the precautions. How we can rectify this issue, why this has happened. If you find this issue, why this has happened, then you can rectify it. For example, the engineer didn't told you that they have tuned the beams, or maybe uh, the calibration has not been done on the daily QA3 during the. So then these kind of the things you have to address in a way that you can solve the problem. So that makes sense?
Yes.
Okay, so the follow-up question for this one, I can ask you the follow-up question. If you using your symmetry check by using the independent system, most likely you have a profiler, IC profiler or whatever, 2D array. So if it is still the same problem persist on the IC profiler, how you would leads to adjust the symmetry of the energies? What step you will take to you can answer now. Anyone can answer.
Ahmed, would you like to answer this question?
अच्छा आई एम सॉरी, मेरी तरफ थोड़े से वो शोर भी है और इंटरनेट की डिसरप्शन भी है, तो मैं इस वजह से कोई आंसर शायद ना दे सकूं.
You can write answer on
कोई
the
बात
chat
नहीं,
box as well.
ये कोई बात नहीं, आप ट्राई करें, अगर नहीं समझ आएगी तो हम आपको बता देंगे कि कोई और आंसर कर देगा.
All right, could you please repeat the question?
My question is, you doing an independent check that the symmetry on the IC profiler. You did the daily QA3, it's showing that 2%. So do you think that you can try on the IC profiler and you get the same results? What would you do in Sol to make the machine clinically release okay?
सर मैं इस सिचुएशन से गुजरा नहीं हूँ, तो आई एम नॉट श्योर कि इसकी क्या राइट अप्रोप्रिएट स्टेप्स होने चाहिए.
सर
Doesn't
मैं
matter
अगर
whatever you
थोड़ा सा ऐड करना
can answer.
चाहूँ, जो जहाँ तक मुझे आइडिया है, मे बी शायद वी कैन गो फॉर
जी please.
वाटर टैंक फैंटम लगा के उसकी प्रॉपर जो डोजिमेट्री है वो हम करें, अगर इन केस दैट थिंग इज नॉट वर्किंग एंड रिजल्ट जो है वो ठीक ना आ रहे हमारे.
Very good. Exactly. Water tank is your gold standard. Gold
Yes.
standard. Always go back to water tank. And the one thing you, because sometime in clinical environment, because this is actually asked in a clinical environment. Me? Okay. Can you hold a second? I have a one person to visit me. Yes.
Okay, sorry, I've just sent you an email including.
Sorry. Yes, your gold standard is your gold standard is your water tank. So just go back to the water tank. The best approach is to use the water tank. And there in a clinical environment, there's a chance because you can't do it in the morning because they have already scheduled the patients. You can quickly find all the patient which is actually 6 MeV and 12 MeV. Just put them on a side and see, you can treat these patients on some other Linux and let the machine release for clinical use for other energies, and put a condition that 6 MeV and 9 MeV, 6 MeV and 12 MeV is not clinical. So then, and discuss with the artist and find the time, because this is what in clinical environment you do actually, doesn't it? Because you can't take the machine for like 2-3 hours and do the water tank, and you know, if you put a water tank, you need 3 hours at least minimum. So this is what it is. And second bit of it actually, because you're going to water tank, you have to make sure why your profiler is giving you the same result. That's another issue, because the examiner can catch you on it. So why is that? So it could be the setup issue, it could be the array calibration of the system itself, or maybe it's a true, most likely. Maybe this because you can tell them, the examiner, that in my experience, we have using profiler like 5 years, we never have any issues because it's behaved pretty well. And if it is presenting us a 2% in a symmetry error, so it means there is something, definitely symmetry is out, because we have already, when we commission your profiler, we have already compared our profiler with the water tank, and the water tank and a profiler are having a quite good agreements. So, but still for this, like independent checks, I would like to do a water tank and make sure that that the profiler is not misbehaving. That makes sense? So I hope I have answered the questions pretty well. If you have any questions.
सर, जहाँ तक मुझे लग रहा है कि हम थोड़ा सा ना सीक्वेंस नहीं बना पा रहे हैं, मतलब शायद हमें थोड़ा बहुत आंसर आता हो, लेकिन उस ये जिस तरह सर आपने एलेबोरेटली और उसको एक्सप्लेन किया है, हम शायद ना कर पाए, जिस पे हमें बहुत मेहनत करने की ज़रूरत है।
नहीं, मेहनत देखिए, ये चीजें तो आएंगी वक्त, क्योंकि हम लोग वी आर नॉट actually properly trained physicist. The reason is that because if you are actually went through the ACPSCM like WAPM or COM, they have a proper system like that. They do for each individual competencies. They have a 5 competencies. Main competencies: radiation protection, dosimetry, equipment, which is include all the equipment, CT, MR Linux, superficial, brachytherapy, and all these. And the 4th one, so radiation protection, dosimetry, equipment, treatment planning system, and brachytherapy. So these are the 5 main core components. They will cover in your exams as well. Okay, so as soon as we go through this process, we do multiple sessions, like 3 or 4 sessions, then you will be aware how to address the questions. It is not, you can learn in a one day. First session, which I'm giving you, maybe it helped you. Listen it when we finish this session, you can just go and have a quick review what we have discussed, and then put a note in your. There are certain sequences which I already told you in the beginning of the this session. So hopefully it will help you. Let's go. Don't stop here, because there are so many questions you have to be going through this. Okay, so we can ask another question, which is a radiation protection. Let's start from radiation protection. Your radiation oncology wants to participate in a trial which involves 1 CBCT per fractions and a mid CT and MRI, as well as post CT and MRI. What your advice and response to RO in terms of the radiation protection?
Sir, how many cities and how many MR?
Sorry.
इसमें
सॉरी
सिटी और
अहमद,
एमआर
आई
का
मिस
नंबर
यू।
क्या है? आई एम आस्किंग के सिटी और एमआर का नंबर क्या है?
मैं ये कहना चाह रहा था, देखिए क्वेश्चन क्या है, क्वेश्चन को गौर से सुने, गौर से। योर रेडिएशन ऑन्कोलॉजिस्ट वांट्स टू पार्टिसिपेट इन अ ट्रायल। ट्रायल समझते हैं ना आप? which involves one CBCT per fractions and a mid CT and
इन
CT
बिटवीन
and MRI। यस, CBCT डेली है। मिड एमआरआई का मतलब है कि सेंटर ऑफ द ट्रीटमेंट के दरमियान, यानी जो अगर 30 फ्रैक्शन है तो 15 फ्रैक्शन के ऊपर वो सीटी करेगा और एमआरआई करेगा दोबारा से। एंड उसके बाद फिर क्या है, जब खत्म आखिरी फ्रैक्शन होंगे, लास्ट फ्रैक्शन के ऊपर दोबारा सीटी करेगा। जब खत्म हो गए लास्ट फ्रैक्शन, वो सीटी करेगा और एमआरआई करेगा। तो एज अ फिजिसिस्ट आपको क्या लगता है कि रेडिएशन प्रोटेक्शन पॉइंट ऑफ व्यू से क्या करना चाहिए? मैं इंग्लिश में क्वेश्चन इसलिए कर रहा हूँ क्योंकि आपको एग्जाम में क्वेश्चन वो इंग्लिश में करेगा, तो आपको जो है ना इंग्लिश उसको समझने के लिए ना वो जो है वो टर्म्स को अंडरस्टैंड करना जरूरी है बहुत। ठीक है।
All right, sir. But so far I could understand, and I think the appropriate answer could be we need to address we need to look at the doses to the OAR, and we need to incorporate the doses which will contribute in terms of cities. जो सिटी की डोजेज हैं, इवन दो वो सीबीसिटी की सीबीसिटी की जो डोजेज हैं एक सीबीसिटी की वो काफी कम होती हैं, आई बिलीव समवेयर इन मिलीग्राम, बट दे माइट बी पॉइंट ऑफ कंसर्न इन केस ऑफ दोज, लेट्स से अगर लेंस है उसका वो नियर जा रहा है 9 ग्रे या टॉलरेंस डोज के करीब जा रहा है, then this might be the concern, but not a big concern. So I think this is something that may be site dependent as well, कि 30 या जितने भी नंबर ऑफ फ्रैक्शंस हमने वो पूरे थ्रू आउट सीबीसीटी कंडक्ट कर रहे हैं, एंड देन 2 एमआर कंडक्ट कर रहे हैं, 2 एमआर उसके। तो आई थिंक सर नॉट अ बिग इशू रेडिएशन प्रोटेक्शन पॉइंट ऑफ कंसर्न से, रेडिएशन प्रोटेक्शन पॉइंट ऑफ व्यू से।
Anyone else can respond?
Myself, Hamid Jamil. Sir, um, it all depends if it is like a trade-off, like adaptive radiotherapy. If the CT will give the or improve the treatment volume in terms of reduction in tumor volume, then I think it is not a big matter. But if this is a part of trial, then we should know that is there any benefit from this interim CT and after completion of treatment CT. So that is basically the trade-off in terms of their benefit versus the importance.
सही है। Anyone else?
सर फर्स्ट ऑफ
Ashad?
ऑल मैं सर मीटिंग करूंगा विद रेडिएशन ऑन्कोलॉजिस्ट कि वो किस साइड की वो करना चाह रहे हैं, जिस तरह अहमद ने बताया है। और उसके अलावा सर ये अगर ये चीज़ क्लियर हो जाए कि वो किस साइड का करना चाहता है रेडिएशन ऑन्कोलॉजिस्ट, तो ये भी एक बात मैटर करती है। और सर तीसरी अगर इन सब पे अगर कोई पब्लिकेशन वगैरह पहले हुई हो, लिटरेचर रिव्यू जो होता है सर, तो आई वुड डेफिनेटली गो फर्स्ट उस पे, एंड देन फिर मैं आगे बाकी जो अहमद और हामिद ने बताया तो मैं उसी के साथ एग्री करता हूँ।
ठीक है, बिल्कुल सही है। असद, आप कुछ कहेंगे?
Well, I agree with the Arshad and Ahmad as well. Additionally, I can add, like if we are doing a trial, so we must know the doses of CBCT, what settings are made in CBCT like KV and MS, and so the site specific we can adjust. and reduce the dose, there is our option, and we can follow the report of IGRT, and we can follow that protocol. And CT in the middle is, of course, it might be adaptive radiotherapy. For the MR, we don't have any concern about the radiation protection aspect. This is what we can tell to the doctor. And now a latest system like a TrueBeam also gave the report of the total dose from the imaging. And we can add that dose, and we can test whether it is a significant or not.
Because yeah, very good. I think you covered most technical part of the questions, all of them actually very good actually. None of you has actually talked about any administrative. Didn't talk about any administration part of that actually. What do you think? What could be the administrative part of it? Actually?
Well, I think we have to make sure that RTT knows about this thing, that we are doing a trial, and also
you have to involve RTTs.
Yeah, we have to involve.
Exactly.
Yeah, we have to involve
Yes,
RTT, the
definite,
nursing staff, if there is a
Definitely.
need of nursing staff as well
There
for the
are
educational purpose.
exactly.
And also we have to incorporate all
There
the
are three
team
things
of
you have
physics
to be
members,
considered.
and all the doctors are on the board, that the study is going in the department.
Yeah.
And because
Yeah.
there are resident as well, they do the follow up, and
Yeah, the more
yes.
And
Sir,
we can
I think
also take permission. We need to take permission
few
from the
more.
clinical research trial unit as well. So that's very important if we are going
But
to.
this is yes, definitely. Ethical approvals has to be done anyway. That's what I'm saying. These are the most critical point. Whatever Asad said is okay, is good, but this is most important part, that you have to get the approval from ethical approvals before you start any trials or anything. And one another thing, none of you has actually talked about anything related to the trials dry run. Then you wanna see that how much the dose you're getting it actually. If you do daily CBCT, how much the dose can be in, you have to incorporate in your first of all, if I was asked this question, I would go through this I would discuss with the ROS and ask him, can you please provide me the trials and documentations? So he will provide you the trial documentation and see what from the physics side has to be done, what are the prerequisites to be part of this trial actually in terms of in terms of the physics. And then you can go through this and see either you meet these trials or not. And the first thing, the second bit is actually if you are actually in terms of the radiation protection point of view, most of the center, they don't talk about G.
Sorry.
In most of the center, they don't talk about the normally they don't do the CBCT, CTDI. You know CTDI? CTDI के बारे में पता है किसी को?
city dose index.
हाँ, CT dose index.
टोमोग्राफी dose index जो होता है जिसमें